Borderline personality disorder. Have you heard of it? Stay tuned and we'll talk more about it. Hey guys! Today we are going to talk about borderline personality disorder. But first, if you're new here, thank you for joining me. If you are returning, you crazy. Just kidding. Thank you for being here as well. Make sure you like this video, click the thumbs up button if you like it. And if you want notifications when I create new videos, click the bell icon. And that won't send you a text message or anything sketchy like that. But it'll give you just a notification on your phone when I upload new videos. So do any of those if you prefer. So back to borderline personality disorder. So I have my handy dandy DSM-5 out to go into the specifics of what borderline personality disorder is. If you have any questions or comments along the way, comment them below, please. So here we go. Okay, borderline personality disorder. I apologize, I'm gonna look down every once in a while. A pervasive pattern of instability of interpersonal relationships, self-image and affects, and marked impulsivity, beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following. And there's 9 criteria below that I will go through somewhat quickly. But if you have a worry that you or somebody else has this, just kind of keep track on your hands or in your head or whatever about how many criteria are met. You need to meet 5 for this to be a possible diagnosis. We are not diagnosing over this, guys. But I'm giving you the information to be able to move forward. If you think it's a diagnosis you might have, to be able to find a therapist that maybe specializes in it, or to just kind of have an idea when you do go see a therapist that this could be something that is a diagnosis for you. So, number 1, frantic efforts to avoid real or imagined abandonment. So that would be if you think somebody is going to leave you, if you think a relationship is going to expire or diminish. That was a weird word to use there. But if you think a relationship is ending, thank you, that you're working super hard for that relationship to not end. You might be overcompensating, you might be frantically no, don't leave me, and they're I wasn't leaving you, or maybe they were. But regardless, frantic efforts to avoid that. Sometimes people sabotage the relationship because they're I think it's going bad, I don't want them to end it, I'm gonna end it. That's number 1. Number 2, a pattern of unstable and intense personal relationships characterized by alternating between extremes of idealization and devaluation. So going from he's the best person in the whole world, or she's the best person in the whole world, down to they suck, I hate them, I can't believe I was in a relationship with them, you're poop on the bottom of my shoe. That extreme of whoa, what are they? Are they good or bad? Right? That back and forth. Number 3, identity disturbance, markedly and persistently unstable self-image or sense of self. So that unstable, oh, I'm doing really well, to I'm worthless, I'm not worth anything, I look really good, I look really fat. That really quick kind of back and forth. You see somebody with all both ends of the spectrum is what I'm trying to think of, that back and forth. Number 4, impulsivity in at least 2 areas that are potentially self-damaging: spending, sex, substance abuse, reckless driving, binge eating. Those are all in parentheses in there. So impulsivity is quick acting without forethought. So reckless driving without thinking, hey, I could get pulled over. Binge drinking without thinking, how am I gonna get home? So impulsivity is a quick thought, a quick action without thinking through the outcomes of it. So they want to see that you are impulsive in at least 2 areas. Number 5, recurrent suicidal behavior, gestures, or threats, or self-mutilating behavior. So that these characteristics in somebody are that it's somewhat common for them to think about suicide, to harm themselves. So a lot of times we see cutting behavior, but people harm themselves by making themselves throw up, and it's not a self-image issue, it's self-harm that they're thinking of. Suicide attempts, so those are recurrent in a person's life. Number 6, affective instability due to a marked reactivity of mood. So, intense episodic dysphoria, irritability, or anxiety, usually lasting a few hours and only rarely more than a few days. Intense dysphoria, irritability, or anxiety, so like those heightened senses, those extremely heightened. Number 7, chronic feelings of emptiness. Okay, I don't think I have to go too far into that. That emptiness, loneliness sort of feeling. Number 8, inappropriate, intense anger or difficulty controlling anger. Frequent displays of temper, constant anger, or recurrent physical fights. And so oftentimes we see with this that people are angry so they're yelling and screaming. People are angry so they're physically fighting. That intense, prolonged anger, oftentimes in reaction to something that doesn't feel like it equates. So I'm angry because somebody cut me off. That anger now lasts for hours. I might follow that person, want to fight them. So that type of behavior for this characteristic. And the last one, transient stress-related paranoid ideation or severe dissociative symptoms. So the paranoid of like everyone's out to get me, that can be an example of somebody with this. Everybody hates me, nobody knows me, nobody likes me. That kind of like paranoid type of thought. Severe dissociative symptoms. So disassociating is like not being in touch with reality really, or like pulling yourself out of reality, or not being able to like connect things very well, if you will. So those are the 9 characteristics of somebody with borderline personality disorder. Remember, they need to meet criteria for 5 of them. Borderline personality disorder, there's I oftentimes get asked about treatment for that. There is not medication for any personality disorder. So any of the personality disorders you hear, medication isn't a form of treatment for those. The treatment for personality disorders is therapy. And so oftentimes I tell people who come in who meet criteria for a personality disorder to expect that therapy can likely be a lifelong commitment to them. Kind of like medication is for some people with other disorders. Therapy is likely their commitment. And I'm not saying once a week or twice a week necessarily. Talk to your therapist about that. But people with personality disorders really, really, really benefit from somebody who can talk them through what their diagnosis is, and then kind of compare what life looked like for them and currently looks like, and in the future what it looks like, to help somebody tease out what is real versus what is the mental illness that I'm going through and have. So that's that. If you have questions or comments about borderline personality disorder, please comment them below. Thank you guys so much for listening. Have a good day. Bye-bye.